All right, well, a new report by the Human Sciences Research Council has found that due to the impact of the national lockdown on South Africans' financial security, 15 million people cannot afford to feed themselves. The report found that more than half of informal settlement residents had no money for food, and about two-thirds of residents from townships also had no money for food. To help us unpack this report further, we're now joined via Skype by Professor Mosa Moshabela, Dean and Head of School at Nursing and Public Health at UKZN School of Medicine. A very good afternoon to you, sir. Thank you so very much for joining us, Prof, and we appreciate you giving us your time on International Nurses Day.
Thank you for inviting me, and I'm also celebrating all the nurses.
Talk to us, please, about your findings. I mean, they're very concerning in relation to access to food. You found that just under a quarter of residents, that 24% have had no money to buy food. Take us through some of your other findings.
Yeah, I think that because of the lockdown, we understand that there's been a lot of disruption to the way people engage with society, including the way that they need to engage with work and income and so forth. And it was an important question to try and understand the extent to which the lockdown, in as much as from a public health point of view, can be quite beneficial, in what other ways could be a problem for families. And it was quite a shock for us, and also a big surprise to hear people saying that at the moment that they were being interviewed or they were completing the survey, up to a quarter did not have money to buy food at that time. And basically it highlighted the extent of food insecurity that existed in the participants. But the biggest impact was actually seen amongst those in the informal settlements, where close to 3 in 5 did not have money to buy food. In townships and in rural areas, we found that 2 in 5 did not have money to buy food. And that's a big problem in terms of food insecurity observed in the study.
Does the study take into account or consideration rather some of the interventions that government has sort of undertaken to help those particular parts of our society that are vulnerable at this time? The fact that there is, for example, a 350 Rand grant that's been given for the next 6 months, and the fact that food parcels have been handed out. Does that study also take that into account?
That's a really important question, because the sequence of event actually matters. One of the things that we learned from this study was the fact that it was quite a challenge. At the beginning, the president and the National Coronavirus Command Council announced all these relief packages. But what we observed was that all of the initial packages that were introduced took a while before they could get into the hands of those in the households. So when we did this study from the 9th of April until towards the end of April, we did not necessarily, it did not coincide with the time when many of these relief packages were actually in the hands of our participants. It would be really important for any follow-up work that happens to take into account the point at which the interventions were made available to the households, so that the sequence of event could be assessed to the extent to which it actually makes a difference. Because you might get an additional 350 rands, but then if people still feel that it does not necessarily make a big difference in terms of putting food in the table, that raises new questions. But at the time when we did the study, these interventions were not necessarily in the hands of those in the households.
Prof, I know that the Department of Science and Innovation supports this research. I see that the Health Sciences Research Council, along with the Department of Science and Innovation, are together on this. What are the implications of this finding finding, or maybe if I put it differently, what is the purpose then of this service? What can you do after this? Are you then going to hand over and then there's something done about it? Because it's one thing to have some kind of research, but then what will it actually then do in helping those that you are trying to help at this point?
Absolutely important. And, we worked very hard to make sure that these results are presented to the Department of Science, together with the Human Sciences Research Council, to make sure that these results are presented to the Department of Science and Innovation, including the Director General, including the Minister. And also then the Minister made sure that the results are presented to the President and to the Minister of Health. And they were further the next day presented to the National Coronavirus Command Council. And this was just before the President addressed the country to actually specify, the need to make sure that there is a different approach to, for example, food parcels, where he was talking about e-vouchers and the importance of dignity. What this study brought to the debate, really, at the time, the debate was very much about the tension between the health and the economy. But then what it did, it brought the sort of human condition, the human face, and the stories of the people to the forefront. And then that got taken seriously in the way that the relief packages were then kind of discussed. We cannot necessarily claim kind of direct implications, but we can actually say that the information was made available. Yeah. And the response that we saw, to us, it was satisfactory, because people were now starting to talk about having to engage with food security in a way that restores the dignity of the people. And for us, that was really important, because it's not just a matter of making food parcels available, but how do you make support and relief to the household available in such a way that people understand that it is still dignifying, rather than kind of take away or erode their dignity in the way that we've seen in the media.
Prof. Mosa, as we wrap up our conversation, I'd like to get an understanding from you how you would like government to treat this information going further, and also bearing in mind the fact that it doesn't stop here. The after effects of lockdown, COVID-19, will be felt for a very, very long time, perhaps even next year, the year after, as we're looking at people losing jobs, even getting retrenched, all those kinds of things. If we throw that all into the mix, the situation might actually become worse. So how must government then address this situation? And I suppose you'll have more findings as well and more reports to show how dire the situation is afterwards. How would you like this information to really be treated with the kind of attention that it really does deserve?
Yeah. So for me, I think that I've been really happy with how the leaders in the country have taken these findings seriously and engaged with them. That is enough for me. But the way, as you say, it's a starting point. What would really help is to make sure that as we conduct further surveys down the line, the leaders are able to use them as a point of reflection to see whether things are getting better or worse. And that reflection should continue to inform the decisions that are made at a policy level. And for me, that's really important. For the first time, I can see this sort of direct engagement with science, with evidence, in the way that policies are being discussed and engaged with. And of course, there are other sectors that are involved. But I do think that if our leaders can continue to listen to the evidence of what is happening with the people on the ground, including the stories themselves, listen to the stories, and then respond in real time to those needs, that would really be powerful. For me, then, science is not just there to produce a paper, but then actually it translates into the direct impact on people's lives. I would really like to see that.
Prof. Mosa, it's been an absolute pleasure having you on our show. Thank you very much for your input and, of course, that much-needed research. Thank you, sir. All right, that's Professor Mosa Moshabela, the Dean and Head of School of Nursing and Public Health at UKZN School of Medicine. We're going to take a short break. Your business with Colin after this. Do stay with us.